book, and I know how stressful it is. And I've also now had the opportunity of being on lots of interview panels. And basically, I've spent the last few years collecting wisdom from people to try and put together some good tips and good advice. And it's not that I'm a brilliant interviewee. Now I feel pretty confident, but I've had difficult times as an interviewee, in particular as a registrar going for my kind of fellow job when I was in Sydney. I opened the door to the interview room and I was totally prepared for this interview. I knew I was going to nail this interview. Honestly, I've never felt so confident. And I had one task in my head, which was before I sit down, I'm going to make eye contact with the interview panel. I'm going to smile at them all and I'm going to shake their hands. This was before COVID, when you were allowed to shake hands. And I opened that door knowing exactly what I was going to do. And I was ready in my new suit, looking great, feeling great. And I walked forward to the chair of the interview panel, who stood up from behind the desk to greet me. And it was like a double desk. And I strode towards her, undeterred by the large space between me and her in the desk. And I reached forward purposefully to shake her hand. And I was so confident when I shook her hand that I pulled her towards me, and she face planted on the table, on the desk in front of me, and in front of what felt like a very large interview panel. I knew then that in spite of all my preparation, there is always something that can happen that's unexpected. There's always something that's going to happen in your interview that's going to catch you on guard. So your job is to do as much prep as you can, and also to prepare for the unexpected. I have put together a book, an ebook about interview skills, which has just gone online today. I was motivated by the deadline of this, so I'll put the link up there, which you'll be able to see, and you can check it out. It is for consultant interviews specifically, but the tips are transferable to grid interviews. And I'm going to share my 5 top tips with you today on what I think you should be focusing on for your interview. And I hope you'll join in the chat. We've got kind of 15 minutes or so. So please, I'm keeping an eye on the Zoom chat. So ask comments, questions, and we'll see how we go. And I can adapt to what you're asking, what you want to know. So my first tip is know how to tell them about yourself. Okay, now every single interview, this is going to be your first question. They're going to ask, so tell me about yourself. Or they might not word it like that. They might word it slightly differently. Take me through your CV. Tell me about your experience to date. Tell me what brought you to apply for this role. Whatever it is, there is a pretty certain chance that this is going to be your first question, regardless of what type of level of interview you're going for. So this is an easy one for you, because you know it's coming. So you need to have prepped it. There's no excuse not to have prepped it. Now, I know you probably all thought or learnt about CAMP, but I'm going to suggest a slightly different system for you, which is PERM. And I'm going to take you through it. And PERM, it starts with personal. I think that rather than CAMP, which ends with personal, what you should be doing is thinking about starting with personal. And the reason I'm recommending this is because often we're so wound up when we go into interviews that you don't come across as yourself. You come across either very quiet and shy, or very, straight, tight, nervous, stressed, whatever it is. And when you start with something personal, that's how you build that connection with the panel. So it doesn't need to be something private. So there's a difference between private and personal. You're not sharing your deepest, darkest secrets, but you're sharing something that's a bit more about you. And that might be what brought you to love your specialty. So I work in PEM, so, I love coming to work every day. And, I really feel when I get up in the morning and I walk through the doors of the hospital that I am really excited to be at work, and that's what drives me, and that's what's driven me to apply for this job. Or something for you if you're a marathon runner, but you manage to balance work and play. Whatever it is for you that you want to share, try and share it as your intro, because that will just help them warm to you. You'll automatically relax, you'll automatically smile and be more yourself. And then you can move on to the rest. So I know this takes you outside the comfort zone of camp, of what we've been told or what you've learned to do, but try it out. You might find it settles you in better. And then the E in PERM. This is for experience. This is just telling them about your clinical work. Now, remember, you've all going to have done similar things. So everyone applying for, your grid job will have done ST whatever 1 to 6, and you've got up to whatever stage, and you've done all the jobs you've done. Everyone's basically going to have done the same thing. So you don't need to detail every single job you've done. What you want to do in the experience element and sharing your clinical experience is to think about what sets you apart from other people. Because that's what you want. You want something that sets you apart. So what have you done that's different? And it doesn't need to be clinical. It could be another experience. Maybe you've worked overseas. Maybe you did a year of project elsewhere, or some non-clinical work, or whatever it is. So yes, you say, I've done my ST1 to whatever, but also I've done this. So when you think about experience, what you're going to share, have a think about what makes you different. What is it that's going to set you apart from others? And then you're going to go on to the R in PERM, which is for research or education. If you've got any publications, now's the time to say what your role was in the publication as well, and where you were, or if you're a lead author, that's great. If you've been involved in research in the department, as some of you will have been associate PIs or whatever, that's great to share as well. Not everyone is going to have done that, and that's fine. You might have just recruited patients in your department for research trials. That's all good as well. Also, you can focus on education if that's more of the stuff you've been on. You've been running the teaching program, you've delivered teaching at whatever events, you've designed teaching programs. These are all the things to bring in here. And then you're going to get onto the M of PERM, which is management. You're going to talk about any management experience, leadership experience, dealing with complaints, reviewing guidelines, organising rotas. So this is what you need to do when you get to a tell me about yourself question. And as your kind of bonus tip here is that this structure, PERM, can be used for lots of questions. It doesn't need to be just the one that's tell me about yourself. It could be anything. Okay, so just bear that structure in mind when you hear another question. What makes a good educator, for example? Okay, your mind might be spinning. What have I got to say about a good educator? But actually, you could think through that PERM. So you could think personal, I really get excited sharing my knowledge, whatever experience. I've had loads of experience educating, and that's what you want. You want someone who's educated in different areas, and you can take it through that structure. And you don't have to use every element of that structure in every question. You can pick the bits that you want, but keep that structure in mind because it can apply to lots of situations. My second tip is to get your examples ready. Okay, for sure you are going to be asked about examples. So I'm going to ask you to type in the chat. Is the chat? I don't know if the chat's actually able to. People are able to type because I can see that no one actually has.
Yes, they are.
They are. They're just being very quiet. Okay, so please, yeah, there you go. Thank you. So type in the chat. What do you think makes a good example? So I'm not asking you to give me a good example. I'm asking, what do you? Thanks for posting the link. What do you think makes a good example? How are you going to choose this? And by this, I mean when they ask you, like, tell me about a time when you had a conflict with a colleague, when you had a conflict with a family, when you made a mistake. Personal experience. Okay, yes. So I'm going to say that's a really good one. So personal experience, and Andy, I'm going to say that it should be authentic. So that's my first tip for your examples. It's tempting to kind of make one up, like you wish you'd had an example that illustrated this, but they're going to see through it if it's not authentic. You're going to get caught up in a web of ever-expanding lies. So make sure that your experience is authentic. So reflection from Diana. Yes, make sure you've reflected and learned. And it's really good if it's not just learning for you, fine, but also learning for the department. So ideally, you'll have had some shared learning with your colleagues so that some element of your learning was used to educate others. Be specific, personal and specific. Yep, so that's good. Reflective learning, we've got showing growth and development. So interesting or unique. Okay, we'll come back to that. Being succinct and evidence of learning. Okay, these are all good. So yeah, be authentic. The next thing is that it shouldn't result in significant patient harm. Okay, now I know we all make mistakes. I make mistakes all the time. I'm sure you've made plenty of mistakes. You may have been involved in a significant incident. This is not the time to bring it up. Okay, so don't pick an example where a patient died and you might have been culpable, or, you know, where something terrible happened. So there's plenty of examples. You've got plenty of experience in healthcare to choose from. So don't choose one that's resulted in significant patient harm. The next thing about your example is you need to be the key player. Okay, so it's not a time when you watch something happen. They want an example of something you've been in. So make sure you're a key player in the example. And show vulnerability. No one wants to hear an example of you being a superhuman robot and just, you know, bossing everything. You were great, you were awesome. You want the example to show some vulnerability, that you had a struggle, that you were able to step up and deal with it. The shared learning we've talked about, and being reflective yourself. But actually, I don't think it needs to be unique. Someone had said interesting, unique. So interesting, maybe. Unique, I don't think that it needs to be unique. What you don't want is a situation where they think like you're the only person who could get into that situation. It's good if it's relatable. So it's something that, yeah, that happens all. Yeah, I remember when a family got really upset because they were waiting for so long in ED and I had to deal with it. That happens all the time. So I don't actually think it needs to be a unique, spectacular situation. It needs to be a relatable thing, but one that actually happened to you. And again, you can use a structure to go through these examples as well. But think about your examples. So in the ebook, I've got a list, but I'm sure you could put together, I've got a list of 50 examples, I think, to think of, but you can start to put together your own list as well. And these are examples that you should be prepping before you go in. So you don't want to be thinking on the spot, right? Okay, let me think about a time I made a mistake, because you're going to start to stress. And instead of thinking about actually giving your answer, what you're going to be doing is thinking about, you know, what example to use and whether you've chosen a good one. So it's predictable. There's a predictable list of examples they're going to ask. Think about them before and go through each one and think, is this a good example? When you're going through the examples, what you want is to use a structure. So this is the structure I use, which is IMSO. So it's incident, mission, steps, and outcomes. So the incident is simply what happened. So tell me what happened. And then you go on to mission. What was your goal in this? Okay, so what was your role? So when you talk about the incident and then you say, what were you? You're the team leader, you're the reg, you're the whatever, and you knew what your role was and what you had to do. What steps did you take is the next thing. So what did I actually do to help this situation or to deal with this conflict? And then outcome. So what happened in the end? And that's going to include your reflection. So when you go through this structure, it's sharing your example, but then looking at how you actually used it to learn. And a common mistake in examples is spending too long in the story. So the story is fine, but the story isn't the point of why they're asking the question. They're asking the question to hear about you. What did you do? How did you deal with the difficult situation in front of you? So the story itself should be short. Okay, you should be able to tell it in 1 to 2 sentences. If you can't tell your story in 1 to 2 sentences, you either need to vastly edit it down when you're practicing, or just use another example. If it's too complicated that it needs a big long explanation, it's not a good example to use, which is another reason why kind of it being a relatable example or a common example was probably easier, so you don't have to spend loads of time explaining it. So keep the actual story short, keep the incident short. And the bonus tip is don't just use an example when they ask you, tell me about a time when X. Examples should be brought into every single situation. Okay, so every time you're giving an answer, you use examples to back it up. It helps add weight, add gravitas, add authenticity to what you're saying. It backs up your claims. So always remember, these examples that you prep in advance, even if they don't ask you for that specific situation, you can still bring them in. So the third tip is to know your strengths and weaknesses. Okay, so they may well ask you, tell me about your strengths and tell me about your weaknesses. So what do you think makes a good strength? I don't mean tell me your good strength, but what is it that would make a good strength, do you think? How are you going to choose what strength to share? You have lots of positives, I'm sure, but you would have to pick one to tell them. What's your greatest strength? How are you going to choose what it is? So you want to provide, definitely want to provide examples. So that's good, because there's no point saying, yeah, I'm brilliant at X. I'm a great team player, but then no examples. So teamwork is a specific good example, yeah. But how do you choose what characteristics? It, in a way, depends on the speciality. Okay, so these are general things: communicative, teamwork, of course. Yeah. Yeah, thinking, so yeah, fine. So something that's related to your specialty. So what I would say about your strength is to be specific. So I said, like, I'm a great team. So something like, I'm a great team player and my 360-degree feedback demonstrates that. Okay, that's not a great example of a strength. It seems like it's good because I've said my 360-degree feedback demonstrates it, but actually I'm not really saying much. What would be better is I'm a really good team player, and that means that I can work with all personalities, introverts, extroverts, people who are inexperienced, people who are experts, whatever my role is on the team. I understand the key duties of that role and I know where I fit into the team. And my 360-degree feedback reflects that specifically. And I've had comments such as, everyone loves it when Tessa's in charge, you know, Tessa helps bring out the best in all the team. So this is a better example because it's more specific. So think about whatever you're thinking your strength is and try and be more specific. But also keep it relevant. So yeah, a few people have said strengths is related to the specialty. So keep it relevant. So for example, saying that my strength is I'm really good at setting up a GRID system. That's all right, but it's not, if they've already got a GRID system or they don't want a GRID system, then it's just a very specific strength that is not that relatable. Instead, you could say, I'm really good at seeing projects through from start to finish. I've developed a new GRID system from scratch, got it up and running in 3 months, and we got 50 GRID certs submitted in the first month. And I did this through managing the project, managing the team, and using the skills of each team member. I held regular meetings and I ensured that we all had a shared goal and we had a shared vision. So that's a much more relevant example, because even if they do or don't want a GRID system, it actually doesn't matter because I've shown a strength that is applicable to them as well. And the final thing about when you're thinking of how to demonstrate your strength is to just go a bit deeper. So you don't want to be someone who just, yeah, you're good at getting jobs done, you're good at ticking off the jobs on your list. Think about the level you're applying for, okay? You're at senior reg level. You need to show that you can start to make decisions, start to think about broader management, and, you know, begin to operate at a more senior level. That's what you should be demonstrating. So make sure when you talk about your strength, you go that little bit deeper under the surface to get a bit closer to what they're looking for. Then we get on to weaknesses. So you're going to have to tell me what your biggest weakness is. Now, there's lots of ways where you feel like you could go terribly wrong here. So please have a think about what your weakness is going to be before. There are certain things that are going to be absolute no-nos about what to say, like terrible ideas of what to say for weaknesses. What things do you think, you can post in the comments, are things that you should definitely not be saying as your weakness? So while you're thinking about that, I'm gonna give you a few broad tips, which is don't go for a cliche. These are some good examples coming through, so you can keep them coming. Yeah, you don't want someone lazy. Don't go for a cliche. So that I'm a perfectionist thing, don't say that. It's just it is such a cliche, and you know it's probably not true. I mean, there may be some elements of truth, but try and not use something that's just overused. But also don't fudge your weakness by making it as though it's a strength. So don't say something that you've completely conquered now, so it's no longer a strength. You know, I used to be X, but now I've overcome that, and now I'm all over X, so there's no problem. Because it's not really answering the question. They want to see some vulnerability. So you want to show a weakness that also puts yourself in a decent light. So you might have, you've acknowledged the weakness, you've started to put a plan in place, there's still room for improvement, but you've really got on top of whatever problem it was having before. So show vulnerability, but try and make sure that it's something that is not going to be detrimental to the department. And we've had some really good examples here of bad ideas to use it as a weakness. So the things that you should be avoiding here is, so making something up, definitely same as before, be authentic. No one wants to hear a made up answer and see you get caught up trying to blunder your way through it. The other big mistake is a weakness that's been conquered, because I don't think that really answers the question, although your interviewers might be kind to you and say that it does. And then we've got these no-goes. So we've got some really good examples here. You're disorganized, lazy. I don't think anyone would really say they were lazy in an interview, but yes, don't do that. Introvert, okay. Staying late after work all the time, terrible at presentations, then improve. That's a good example. Yes, that's a good example. So struggling with non-verbal communication skills. Okay, so the things I would avoid is saying that you've got a problem with communication, saying you've got a problem being disorganized, or saying you've got a problem not being able to assert yourself. Because for me, as someone looking to employ someone on the team, I think these are key skills that you have to have. If you've got someone who says they've got communication problems, it's a red flag, and I would not say that. So I'm sure if you dig deep, you would be able to find other weaknesses. So I would just consider the implications of what you choose to say. Being shy is a good example. I think you need to be able to show that you can overcome it. So it's quite an honest example. You don't want it to be that like you're a complete pushover and you'll never be able to stick up for yourself. So it's a lot of the weaknesses are about how to present it in a kind of positive light. So being shy is not, I wouldn't say it is a no-go, but I think saying you're a terrible communicator or terribly disorganized, I would just avoid them. But saying you're shy, I think that's fine, as long as you have a strategy for how you're going to present that and how you're going to overcome it. So yeah, I think that's fine. So have a think about what you're going to say when they ask you what your strengths are or what your weaknesses are, because it could well come up. My fourth top tip out of 5 is to think about structure and timing. So are you the sort of person who rambles on forever and no one can shut you up, or they have to tell you to stop? Or are you the sort of person who does a quick answer, gets it over with, and is just desperate to get to the end? Because I do think we tend to fall into 2 camps, and both of these mean that you're not going to be able to score the most points that you can. If you answer too quickly, your time's over. You've gone through your questions. You can't have scored as many points as the person who answered the question fully. And equally, if you ramble on and they don't stop you for whatever reason and you don't get through all the questions, then you're not going to score points. So it's just finding that happy medium, that balance. On average, I would say your answers should be between 2 and 3 minutes. And it's very hard to judge that time. The only way that you are going to learn how 2 to 3 minutes feels is by practicing. You have to practice. You have to practice with a timer. The more you do it, the more you will get used to what 2 to 3 minutes seems like. And for some of you, it will seem very short, and some it will seem very long. And either it's fine. You just need to know what your style is and what you're aiming for. So don't go on much. If you're going on too much longer than that, I think it's too long. And if you're answering a question in less than a minute, I don't think you can be doing it justice. It's possible, but I don't think you can be doing it justice. Try to have a structure when you're giving your answers as well. It's not always possible if you're thinking on the fly, but if you know, for example, in some of the ones we've discussed, when you've come up with your examples, have a think and think about the structure you're giving. So what you want is to tell them, ideally, highlight what you're going to be saying. And the easiest way to structure is to have 3 points. So the best way in the ideal answer is to say, okay, thanks. So to answer this question, I'm going to cover 3 key areas: area A, area B, area C. And then you go through and you go, okay, so for area A, I would say this. For area B, and so on, for area C. And then at the end, you're going to say, okay, so I've looked at area B, A, B, and C, and that's the way I would handle that situation, or that's the reason that I think I should get the job. So it seems obvious when you're literally flagging the points as you go, but remember, you want to help the interviewers give you points. They want to give you points, but sometimes when you highlight it to them, they'll write it down in their notes. It will make it easier for them to spot when you're saying whatever it is you're saying. So think about the structure. If you can, try to structure your questions and answers in that way. And my final top tip is to plan for panic. So I told you the story at the beginning when I pulled the interviewer over and she fell face first onto the desk. And that was a horrible moment in my life, but there'll be plenty of others, and there's plenty of others that I've had where you can't think of the answer. You feel like you're starting to sweat. You can't think of the example. I'm sure you've all been there. What you need to do is to prepare for that, because it's easy for us to prep for all the answers. Okay, I know what I'm going to do when they do this, but you need to have a plan for what to do when panic sets in. And there's a few strategies that you can use. So the first is you can project calm. And what that means is that often when you think you're going red or you're sweating or your heart rate's 200, it's actually not as visible to the panel. So remember, what you feel is what you feel inside. You can still project calmness, and that's what you should be aiming to do. The second thing is to embrace silence. So we often feel awkward having a pause. That pause can seem like a really, really long time to us, but sometimes just having a pause and regathering your thoughts makes all the difference. When you take a pause, when you allow your thoughts to settle, when you allow yourself to breathe, you can often just pull an idea or get yourself back on track. And if you do make a mistake, if you can't answer the question and you have to move on, or you think you've messed it up, don't dwell on it. You need to be able to move on and not spend the rest of the interview thinking about that one question, because it's just going to mean that it's going to have a knock-on effect on all your future answers. When it's done, it's done. You can think about it after, but you don't need to think about it at the time. So have a strategy, have steps that you will go through. Okay, this is it. I am having the terrible moment. I am panicking. I have pushed the interviewer over, whatever it is, and go through the steps that you had planned in your head. So these are my 5 top tips for how to start your interview prep. This is me on Twitter, where you can find me, and you can message me or get in touch anytime. And thanks for inviting me, Nadia. I will hand back to you.
Good evening, everyone. Thank you, Dr. Davis, for the wonderful talk. I'm Sharmila Manivannan, and I'm one of the regional representatives for the team Softlanding. Thank you for the wonderful tips. And now I'm going to introduce Professor Sinha. He's a pediatric respiratory consultant at Alder Hey Children's Hospital and also honorary associate professor in child health. Prof. Sinha is the clinical lead for National Asthma and COPD Audit Program and is also a respiratory CSAC panel member for the last 5 years. Prof. Sinha, we are very happy to welcome you to today's evening, and the floor is yours. Thank you.
Thank you very much for inviting me tonight, and really well done, you guys. I think you've pulled together an amazingly good session. I hope it's useful, and thank you for the kind introduction as well. Dr. Davis's talk was fantastic, and she's kind of said, I think, everything that I thought I was going to say, but just far better. But I was just going to give some reflections really on my time on the CSAC for respiratory, where probably my favourite thing in the CSAC. No, not my favourite thing was doing the grid reviews, which you guys will do every year when you're successful and you go and meet the CSAC and tell everyone how you're doing. But my second favourite thing was doing the interviews, and it was because it was a really exciting time to see, the next generation of people who are interested in your specialty, and that's very much what the grid interviews are about. They're about the people sitting in the panel looking to see their next generation of colleagues, and people are really going to be supportive. They're not going to try and trip you up. They're not going to want you to fail. They want you to do really well, and they'll be pleased and to some degree grateful, really, that you've applied for the specialty in the first place. They'll feel that you and them are on some kind of wavelength already. So do enjoy it. It's actually pretty fun. It's easy for me to say because I'm not going to be on your, sitting in front of the screen. But do enjoy it. It was interesting listening to Dr. Davis's talk. I was reflecting on my interviews that I've done in the past. My weakness since 1995 has always been, for any interview, has always been my computer skills. I've made no effort to improve my computer skills, and I think it shows. But yeah, choosing a weakness can be tricky. Computer skills has always worked well for me. And I was thinking about times when you fall flat on your face or pull the interviewer over. My grid interview presentation didn't go to plan because when I opened my slides, all 6 of them had just turned into plain black screen slides, and I just had to kind of wing it a little bit. And my presentation was about who should manage empaimas, surgeons or respiratory pediatricians, and the only slide that had a picture on was my last slide, where I was trying to kind of convey the idea that there's no such thing as a desert island empaima where you can only have one person. It's very much about the team. And so I had a picture of a desert island, and that was literally the only slide that came up. It was ridiculous. But as Dr. Davis says, it's about just putting on a calm persona and getting through. So I too have 5 top tips, and some of them overlap a little bit with Dr. Davis's talk. But the first thing I think I would say is that the first stumbling block people come across in the GRID interview, I think, or my reflection on this, is that I think I was seen as a little bit of a hawkish interviewer, more so than some of my fellow interviewers. But actually my bar was very low, and my bar was always, does this person want to do, in my case, respiratory, or do they just not want to be a general pediatrician? And you will suddenly kind of find yourself in a situation, unless you prepare for that, that you might become a bit unstuck, because a lot of the things that will come as a default to why you want to be a nephrologist or a rheumatologist or a neonatologist or a community pediatrician or whatever, you can actually do a lot of those things by being a general pediatrician. So I think the first thing I would suggest in terms of prepping for your interview is to try and get it clear as to why you want to be a pediatric intensive care person rather than a general pediatrician. There's a lot of overlap, and what sometimes happens in the GRID interviews is that you find, or on the panel will find people who basically got to ST6 and suddenly decided to have a career change, and they're not quite sure what they wanted, and that's not what they want to see. They want to see people who are motivated to do that specific specialty. So there are 2 layers to that. One is, how does being a specialist differ from being a generalist? You know, what do you understand by that? Both of them are excellent jobs, and both of them are incredibly difficult and rewarding in different ways. And the second thing is, what is it about nephrology or neurology that makes you want to do that? What is it that really has lit your fire? And I think that would be my first point, is that question about why you want to do X specialty. Read between the lines a little bit, because that's also what can you gain from working at Bristol or Great Ormond Street that you can't get from working in Doncaster or Sunderland. Yeah. So the second point I wanted to make was, again, echoing what Dr. Davis said about generic skills, and the Greatex, I think, is a really good idea. They might not want one, they might already have one. The idea, I think, behind any of that is that whatever you say, bring it back to a transferable skill. So it seems like everybody, apart from, in fact, me, at some point in their training did a neonatal long line audit and a neonatal jaundice audit. At least 75% of the people on this call will have done that. But the point is, what have you learned from doing that audit that you see as a transferable skill? Is it the organization? Is it the audit skill? Is it the QI? Is it the presentation skill? Whatever it is about it that will mean that you'll be doing equally good audits moving forward in that specialty. I think those will be that would be my top point for the transferable skills. Keep highlighting what you learned that will make you a really good rheumatologist from doing your community peds audit, or whatever it might be. And I think the other thing about audit that is different now to how it was 10 years ago is that, and also different in your part of your career to 10 years ago is that when you were applying for your SHO post, you wanted to do an audit to see whether you were meeting a standard, whereas at this point in your career, you're wanting to do an audit as part of a quality improvement program. So bring it all back to what can you do to make things better for patients in the specialty that you are desperate to work in. The third thing I'd say, and I think there's a few things within this, is don't worry about the competition. Okay, there's a perception that everybody who applies for GRID has got a PhD and has done a leadership program at Harvard and did a PGCE from Cambridge. Those things don't happen. People often have one of those skills really well, you know, teaching or QI or research or whatever. People often have one of those boxes that looks pretty good. Sometimes people have two boxes that look pretty good, but it's unusual to find someone who is the finished article, because you haven't had time in your training to have done everything about everything, and nobody wants you to have done that. So don't worry about the competition. You've got through the process of being eligible to interview because you're pretty good. So you know, be confident in yourself. Again, thinking about what Dr. Davis said, one of the things that causes people a lot of stress is not everybody on the call today will have always wanted to do this GRID. Don't worry about it. That's fine. Some of the best respiratory pediatricians decided at the very last minute that they wanted to do respiratory pediatrics. You know, some of the best intensivists only really realized in ST6 when they did ICU that that's what they wanted to do. So regardless of your story, the point is that you want to, you know, go with that PERM acronym. I think that's really nice. But go, your story is your strength. You know, people talk about USPs, unique selling points. Your story is your unique selling point. You got there for a reason, and there will have been something, if you look back on your CV to date and your training to date, there'll be something that you'll have done that makes you know, your story that has led you up to this point is absolutely laced with positive things that you've learned, and pick out what your point is. I think by the time I applied for my GRID, you know, I applied after I came from an academic kind of training program and then applied. So actually my publications box was pretty good and my leadership box was good. But actually, I think in retrospect, the key unique selling point I had by the time I did my GRID interview was that I'd done an extra year of general peds. You know, so bizarrely, you know, going for a specialty interview, you might think that someone might say, oh, that's just someone who didn't know what they were doing. And I had to do an extra year because I failed my exam. So I did an extra year of general peds. And by the time I was going to my interview, and I don't think I realized this at the time, is that doing that was important. And some of you will have got, well, all of you will have something on your CV that's slightly different to your cohort of registrars that you're currently working with. Pick out what that is and turn it into a strength, because it is a strength. It's who you are, and it will bring something new to that specialty and something unique. And along that line of not worrying about the competition is don't undersell yourself. Like, don't overdo it. You know, we've had people in GRID interviews and you're like, really, you know, it's very easy to pick apart when people have oversold their role in the recovery trial, for example, you know, and that happens all the time. Oh, you know, I was a key component of this randomized trial of 10,000 patients. What did you do? I recruited some patients, right? You know, okay, that's an important thing, but don't oversell it. But, you know, having said that, recruiting patients to a randomized controlled trial is a really good thing. So don't undersell it either. And a really kind of common time that this happens is when people talk about audits, because audits are very much a team thing. Audits are very much the kind of thing where you do with a medical student and a consultant is supervising it. And everybody on the panel will understand that it's, you know, you may have an audit where you decided that you wanted to do something and you took the lead and you registered it and you did it all yourself and you presented it and analysed it and wrote it up by yourself. that might have happened. But if it didn't happen and you were part of the team, that's fine. That's fine. Nobody's expecting you to have led a national or international audit on lupus, but people will expect that you have been a part of a team. So don't undersell what you did. Don't oversell it. Be proud of what you have done. Be proud of what you've achieved so far to get yourself on a competitive interview in one of the best training schemes in the world. So I think should be just get a balanced view on that. I think with underselling yourself, and I don't know if this is the right thing to say, but my experience, whether it be speaking to medical students or doing medical student interviews or doing consultant interviews or national lead post interviews, my experience has been that women and people who don't have English as their first language often default a little bit to underselling themselves as compared with men and people whose English is their first language. Just be really confident. Just be really confident. Go into the interview and, like I say, just remember that you have managed to get yourself to a position where you're being considered for a specialist training post in what is seen worldwide as a world-class training program in pediatrics. Okay, so be confident in yourself. Don't worry about the opposition. Nobody's going to be looking at you going, this is the only person on this interview who hasn't done an MA in medical ethics, because nobody has. So pick out what's unique about you and just run with it. You've done very well to get to where you're at. 2 more points. The first thing is you will be asked about something about your idea about what to do to make things better. If I'm not on the CSAC anymore, but if I was picking questions, I'd be talking about COVID, I'd be talking about health inequalities, I'd be talking about, or I'd be asking about the really big issues of the day in that specialty. Not because you're supposed to have all the answers, but because you 10 minutes before that question will have told everyone how desperate you are to do that specialty. So they will have expected you to have had some thoughts about how to make that specialty better. The key things at the moment are, inequalities, COVID recovery, improving outcomes such that pediatric outcomes in the UK get close to other rich countries, those kinds of things. And I think with that, we often, so say, for example, if someone were to say, right, well, in pediatric oncology, how should we go about reducing inequalities? And on the one hand, that's quite an easy answer because you can pick almost anything and say, this is what I think you should do. On the other hand, it's a bit difficult because people often go to 2 extremes and, somewhere between, okay, in my grid, I'm going to do a 25 million point mega big data study to identify an artificial intelligence program that will pick children out who are going to get leukemia. In between that and saying, oh, over the next 3 years, I want to translate all our information leaflets into Bengali. In between those 2 is something that you'd expect a specialist to be. And both of those things have got merits. Both of those things will help people. Both of those things are things that can really make a change. But you need to have an understanding of both. So I think if they're going to be asking you anything about improvement, show that you are open-minded enough to realize that there are probably things that you can do on the doorstep, on the shop floor, which are probably not that sexy, probably not that big a deal in the grand scheme of the entire world, but will make a difference to your patients in Nottingham or whatever. Understand that that's important, and understand that the big data stuff and the artificial intelligence and the human rights approach to inequalities and all these really high ended things, those are important as well. And both of them need to happen. Both of them need to have different people with different skills. But I guess my point is that whatever question they ask you about how might you go about doing this, go in with something local and pragmatic and real world, because they will like that, and go in with something exciting because they want to be excited. They want to see the next generation of consultants in, you know, whatever specialty come in and do a better job than we're doing. That's what we want. We want you guys to be better than us. So that's my fourth point. And my final point is every single answer, bring it back to the team. Team. What did you learn from this? I learned this, that, and the other, and it's really important that you have a team debrief. What did you learn from doing the audit? I learned that having the multidisciplinary team involved in the audit adds a lot of value. Where might you move forward in terms of improving things for children with Crohn's disease? Well, I think one of the things that's really important is having a multidisciplinary team around the child. What would you do to manage bronchiolitis in this case? It's really important to bring the team in. Every single time you've got to bring the team in, because it's just something that you will find bumps up each single mark. Plus it's like totally true. You know, the multidisciplinary multi-specialty approach is the way forward. So team, and always bring it back to the patient. So actually what you really want to do, the reason you're doing any of this is not for your own intellectual curiosities, because you want to make life better for children, and you specifically want to make life better for children with lupus. You can see from my talk that I only know about 5 other conditions outside of respiratory, but the point I think is this, that keep bringing it back to what will be good for children. And I think that's probably as many tips as I have. So I will stop sharing. Don't know if it's now time to move to the breakout rooms or if